So let's talk about September 2, 2015. Let's go to slide 7. We've now moved from August 20th to the second set of brain MRIs dated September 2, 2015, correct?
Correct.
And do you have an image number 13 out of 48 from series number 3 of her MRI?
Correct.
Okay, what does this tell us?
This is, as I told you before, there were literally well over 1,000 images done on each of the 2 MRIs, both on 8/20 and 9/2. This is a single image from the 9/2/2015 MRI. It is a mid-level, about on knee, the slice of bread analogy, diffusion-weighted imaging study. This is representative of the entirety of all 33 images of the diffusion-weighted study on this date of 9/2/2015. It is a normal study.
All right. Is there any evidence of damage to Journey Hudson's brain on this September 2, 2015 MRI?
On any of the sequences, no.
How many did you look at all the sequences from September 2, 2015?
I have.
Did you study them closely to look for evidence of hypoxic ischemic injury?
I have.
Or hyperthermic injury to the brain?
I have.
And what did you find on all of them?
Normal study except for some sinus disease, which is unrelated.
Okay. Let me go to did you review the report of the radiologist who read the September 2, 2015 MRI?
I did.
All right, let's go to that. That is Exhibit 42-64. And what was important to you in this document, sir?
Multiple things. First of all, you don't necessarily order another study that's duplicative unless there's been some interval change. So there had to be some medical basis to order a repeat MRI. Because the first one, they had the report and they knew it was normal. This study was read. I don't know her personally, but I know who she is. She's a pediatric fellowship-trained radiologist. So it could not be a better qualified person to interpret this MRI. And the reason the study was done, I'll just read it. Journey Hudson.
Let's just make it bigger. What were you looking at?
Yeah, thank you. That helps me this close. Journey Hudson is a 6-year-old female status post near drowning. That was the presumptive diagnosis. Previous image and labs normal. This information is directed to the interpreting radiologist, so she's not reading this in a vacuum. Previous imaging in labs normal, but acutely more encephalopathic. What does that mean? That means there's some dysfunction in the brain. She's not acting normally. And this is an interval change since the first MRI that was done at Children's Hospital. MRI to rule out encephalitis versus paraneoplasty. So they're no longer considering either hypothermic injury or hypoxic ischemic injury. They're concerned about an encephalitis, which is not caused by...
I'm sorry, Doctor. I'm going to object to this testimony about being or not concerned about. He can testify as to
I understand. I'm going to overrule the objection. He's interpreting their language. Go ahead, Doctor. Please continue. Remember where you were?
Sort of.
Keep going.
So the clinical concern right now, I'm not implying they're not concerned about Journey Hudson. Their focus of interest or their focus of concern is now between 2 items that are not related to either hypothermic injury or ischemic injury. And they're specifically looking for evidence of encephalitis versus paraneoplastic syndrome. This preceded performing a second spinal tap, which I'm not going to get into, but certainly will be discussed later in this trial. And they talk about the fact that because she's encephalopathic and not normally in control of her faculties, she'll need to be sedated so she's not moving during this study, which is pretty typical. And They're also talking about the need for a lumbar puncture that could be done at the same time to limit the anesthesia contact with this girl.
So this part of clinical history is put in by the doctor before the doctor interprets the MRI.
Correct. He's trying to give the radiologist some idea of where they're headed clinically and see if the differential diagnosis based on this imaging is supportive of their premise.
And what's the conclusion that this radiologist reaches when looking at the September 2, 2015 MRI? We go to the bottom.
No acute intracranial abnormality, no abnormal enhancement. We talked a little bit earlier about contrast in both CT and MRI. They actually gave contrast to this lady, this young girl, to rule out inflammation that would be associated with a possible encephalitis. And there was none. So that further narrows down the diagnostic possibilities of what may be going on with Journey Hudson on 9/2/2015.
Did you find any diagnosis in any of these reports where anyone diagnosed Ms. Hudson as having an hypoxic ischemic injury based on these MRIs?
No.
What about a hyperthermic injury to the brain?